Zanele Buthelezi, in his statement, has disputed some of the NGO statements that patients that were transferred from Life Esidimeni, including from where she worked at the Waverley Care Centre, had left that centre without proper medical records. She says they left with medical summaries, this corroborating the evidence of Dr. Morgan Mkachwa, the former managing director of Life Esidimeni, who concluded his testimony yesterday. Let's take a listen.
The MHCUs upon discharge had a summary report setting out both the psychiatric condition and medical health, in brackets, comorbid conditions, close brackets, with the medication, in brackets, 28 days when discharged to an NGO and 7 days when discharged to hospital, close bracket. The complete file was not transferred with the MHCUs. All the patients were identified with name tags. The MHCUs in our care were not malnutrition, dehydrated or unkept.
Malnourished.
Malnourished, dehydrated and unkept. Thank you, my lady. They were also not in the state when they left. They were also not in that state when they left our care.
Under cross-examination, lawyers representing former Gauteng Health MEC Qedani Mahlangu asked Buthelezi about the process leading up to the discharge of patients.
All patients that were discharged were given medication because we needed to be compliant with the SLA.
Yeah, it would appear that that wasn't the case for 1/5 of them, 20%. That's why I asked you if you have a comment. In other words, there was non-compliance with the SLA in that regard.
Not in the facility that I was working at.
20.3, if you'll turn the page. So we've turned the page to page 824. It says, do discharge patients receive a change of clothing prior to discharge? Yes for 40%, no for 60%. In other words, they leave in one set of clothing and there's no change of clothing in 2/3 or 60% of the instances. Do you have any comment?
My comment will be, when the patients are being discharged to the families, the families will bring clothes for the patients. When the patients go to an NGO, they will be provided with clothes, as some of the families were donating clothes to us.
No, but the point is that most of the patients that you discharge left in the clothing they had and had no change of clothing. That's what this report says in 60% of the instances. Do you agree?
In Waverley Care Centre, when patients were discharged to the families will bring clothes. And when patients are discharged to an NGO, we provided them with clothes, which were donated by some of the families.
And that due process was followed.
The next comment or issue raised is, social workers' report did not clearly record family contacts and preparation of discharge. Do you have any comment?
I don't have a comment because I don't have the audit report in front of me.
In your experience, Ms. Buthelezi, your experience of what was taking place at that time, what you described as a rush process, the concerns of the family members and so on, and your engagement actually directly with the users, did you feel that the best interests of the mental health care users were taken into account?
It was never taken into account.
She says the best interests of the patients were never taken into account. Cross-examination continues on Monday. Chris Alder Lewis, SABC News in Johannesburg.